The doors of Lakeside General's trauma bay blew open at 11:47 on a Thursday night, and the paramedics, who wheeled Commissioner Douglas Paige through them, were moving the way people move when every second of delay carries a price no one wants to calculate. 2 gunshot wounds. One to the left shoulder, one grazing his lower left side, close enough to the kidney that the attending on call had already been paged before the ambulance arrived. Paige had been shot on the steps of a downtown parking garage following a late-budget meeting. 2 clean shots from a distance and then nothing. The shooter was still out there. Chicago PD had a perimeter across 4 city blocks, which meant very little to the man bleeding through 2 layers of gauze on the gurney. Dr. Kevin Stahl was waiting when they came through. He was a compact, efficient man in his mid-40s, who had worked Lakeside's ER for 11 years, and had the particular kind of calm that only develops after you've stood over enough bad situations to stop being surprised by. He moved to the commissioner's side immediately, issuing instructions to the trauma team without looking up from the wound at Paige's shoulder. Blood pressure was low but holding. The shoulder wound was through and through clean by some mercy. The side wound was the one to worry about. What nobody in the room was prepared for was the fact that Douglas Paige was conscious. Not just conscious, alert. His eyes were moving across the room with a systematic precision that had nothing to do with shock or pain response. He was cataloging, taking inventory, the way a man does when he has been in enough situations where knowing the layout of a room was the difference between walking out and not. He let Dr. Stahl work. He answered the standard questions: name, date, what happened, in short, controlled sentences. He didn't flinch when the nurse on his right began cutting away his jacket sleeve to get IV access. He submitted to the blood pressure cuff, the oxygen sensor, the oxygen mask lowered over his face, but his eyes kept moving, kept searching the room with that same quiet, methodical purpose. 3 minutes after arrival, the secondary trauma door opened and Nadia Brennan came in. She wasn't part of the primary team on Paige. She was already in the middle of a shift, 12 hours in, covered in the low-grade fatigue that settles into hospital staff around midnight. And she had come through that door to retrieve a medication tray for a patient 2 bays over. Her dark hair was pulled back under her cap. She was carrying a laminated checklist in one hand. She had every intention of being in and out of that room in under 45 seconds. She made it approximately 6 steps before Commissioner Paige's hand shot out from beneath the tangle of lines and gripped the side rail with enough force that the metal creaked. "Stop," he said. The word wasn't loud. It didn't need to be. It carried the particular quality of a voice that had spent decades being obeyed and knew at some cellular level that hesitation was for other people. The entire trauma team paused. Paige's eyes were locked on Nadia with an intensity that made the air in the room feel different. Not threat, something else. Something that looked almost like a man staring at something he had given up expecting to see again. "Relay," he said. It was one word, just one. And it landed in the center of the room like something dropped from a height. Nadia Brennan went completely still. Not the stillness of confusion. Not the blank freeze of a person who doesn't understand what they're hearing. It was the stillness of a person who understands exactly, who has been waiting for something like this. The way a person waits for a diagnosis they already know is coming. Her clipboard lowered slowly until it hung at her side. Her expression didn't change, but the quality behind it did. The professional composure stayed in place, but something underneath it shifted, tightened, and locked down. "Sir," she said, her voice measured and even, "I think you might be." Meridian warehouse. His voice was rougher now, the effort of speaking pulling at his wounds. Southside, November, 3 years ago. The trauma team had stopped pretending to work. Dr. Stahl had turned fully toward the exchange, the practiced detachment of a physician, giving way to something more human and more uncertain. The 2 CPD officers stationed near the door, Paige's security detail, one of whom was Staff Sergeant Victor Dowd, a broad-shouldered man with a gray crew cut who had been with the commissioner for 6 years, had straightened, their hands moving instinctively before going still again. "That building was burning from the 4th floor. Down when you pulled me into the service stairwell," Paige continued. He was watching her with an expression that had nothing of the aggressive in it, only the quiet, exhausted weight of a man who has been carrying something for a long time and is looking at the only person who can take it from him. I had a collapsed lung and I couldn't get up. You got me up anyway. You carried me down 2 flights of stairs and out a loading bay exit. Before the ceiling came down on the corridor, we'd just left. He paused to breathe, the oxygen mask having been pushed aside in the effort of speaking, a detail that made Dr. Stahl step forward with visible intention. Paige held up one hand, the uninjured arm, the right one, and the doctor stopped. You had a burn on your right wrist, where a pipe caught you on the way through, Paige said. You never told me your real name. You were wearing a paramedic vest, with a name on it that I later found out belonged to an actual paramedic who was homesick that night. I spent 8 months trying to find out who you were. DEA wouldn't confirm or deny. CPDA's gave me nothing. Whoever you were, they'd sealed it tight. The room was very quiet. The cardiac monitor beeped its steady rhythm, indifferent to everything. Every person in that trauma bay was now looking at Nadia Brennan. And Nadia Brennan was looking at her right wrist. She wasn't holding it. She wasn't touching it, but her left hand had drifted, without any apparent decision on her part, to hover 2 inches away from the white fabric of her uniform sleeve. The one she kept rolled down past her every single shift, in every season. Even in August when the hospital's ancient HVAC system turned the break room into a greenhouse. The motion was involuntary, reflexive in the way that the body sometimes tells the truth before the mind has agreed to. She caught herself a beat too late. Dr. Stahl saw it, Staff Sergeant Dowd saw it, 2 nurses standing near the far counter saw it, and Commissioner Douglas Paige, bleeding from 2 gunshot wounds, and running on a blood pressure that should have had him less coherent than he was, saw it and exhaled slowly. Something in his expression settling into a kind of certainty that needed no confirmation. I owe you my life, he said simply, and I've been trying to pay that back for 3 years. The administrator on call, a thin-faced man named Gerald Park, who had arrived in the doorway 2 minutes earlier to manage what he'd been told, was a high-profile incoming trauma, took one look at the room and made a quiet decision. He stepped back into the corridor and stood there, letting whatever was happening inside resolve itself, without the complication of his presence. Dr. Stahl made his own decision. He turned to the secondary staff, 2 nurses, a technician, an orderly, and asked them to step out, citing patient privacy. When the door closed, 6 people remained: Dr. Stahl's, Staff Sergeant Dowd, 1 other officer, the primary trauma nurse and Nadia, and Commissioner Douglas Paige, who was still watching her. Nadia set her clipboard down on the nearest flat surface. She took one measured breath, the kind that buys a person a moment to decide who they're going to be when the moment is done. Then she looked at him directly. You shouldn't know that name, she said quietly. That name doesn't exist anymore. There's no file, no record. I know, Paige said. That's what they told me, repeatedly. For 8 months. There was a faint pained quality to his voice that wasn't entirely from the wounds. But I also know what I saw. And I know what you did. And I have been in this job for 30 years. And I have never once forgotten a face that saved my life. Dr. Stahl, who was a physician and not a federal agent, and had the particular professional clarity of a man who wanted to return to the matter of keeping his patient alive, spoke with careful evenness. Is there something I need to understand about what's happening here before we continue treatment? Nadia was quiet for a moment. Then she said, could you give us a minute? It wasn't quite a question. Dr. Stahl studied her for 3 seconds, then gave Staff Sergeant Dowd a glance that communicated something in the language of people accustomed to navigating unusual situations, and stepped back to the far side of the bay, far enough to give the appearance of privacy, while remaining close enough to intervene if the patient's vitals shifted. She moved to the side of the gurney. She didn't sit, she stood in the way a person stands when they're not sure whether they're about to stay or leave. Relay wasn't my name, she said. It was a designation. I was 14 months undercover inside a distribution network connected to the Sinaloa cartel's Midwest corridor. The Meridian operation was the night it ended, or was supposed to end. The raid was coordinated. CPD, DEA, Federal Task Force. Somebody on the inside knew it was coming. We lost the element of surprise about 6 minutes before entry. She started again. You were in the building because someone on your end didn't get the pullback signal in time. The fire started on the 4th floor from an accelerant device that nobody had accounted for. By the time I found you, the stairwell was the only viable exit and you couldn't walk. Paige was listening with the full, careful attention of a man who had spent decades reading between the lines of reports and debriefs and knowing that space between the lines was usually where the actual story lived. And after? He asked. She was quiet for a moment. After, my partner didn't make it out of that building. She said it the way people say things that they have practiced, saying until the words themselves no longer hurt, which is different from not hurting. His name was Sal Kimura. He was DEA 7 years in, the best field agent I ever worked with. We made a call during extraction. I went for you. He went for 2 informants on the 3rd floor. The roof came down on the 3rd floor. She paused. He knew the risk, we both did. He made the call with me. But knowing that doesn't make it. She stopped. It doesn't make it something you can keep carrying inside an agency that expects you to process loss and move forward and run the next operation. The room held the weight of that, the way rooms do when something real has been said in them. I filed for voluntary separation 8 weeks after the Meridian debrief, she continued. Dia processed it without issue. I had accrued enough to walk away clean. I took 6 months. I went back to nursing school to complete the hours I'd deferred when I was recruited. And then I applied here. She glanced around the bay. The monitors, the overhead lights, the pale green walls she had looked at for the past 19 months. It's not a cover, it's not a step back, this is what I do now. These patients are real, this work is real. Paige didn't say anything immediately. He looked at her the way people look at someone when they're reassembling the picture they thought they had into the one that's actually true. I'm sorry about Kimura, he said finally, I mean that. I know, she said, she meant it too. He reached toward her with his uninjured hand, and after a pause that was not uncertainty, but simply the time a person needs to decide, she took it. His grip was weaker than she imagined it would be, and that fact alone, the realness of his physical fragility beneath everything else, made the moment feel less like drama, and more like 2 people standing in a room after something long and difficult had finally been said aloud. I have a bullet fragment sitting somewhere near my left kidney, Paige said. And I want the person who has been in burning buildings to be in the room when they go after it. Dr. Stahl, who had been monitoring vitals from across the bay, with the focused attention of a man who was listening, while pretending not to, stepped forward. Commissioner, what you're describing would require a procedural exception to hospital protocol regarding credential verification for Dr. Stahl. Paige's voice had recovered some of its habitual authority, though the effort showed. I have been shot. I am aware of hospital protocol. I am also aware that the woman standing next to me has demonstrated a greater capacity for keeping people alive under pressure than anyone in this room is currently prepared to account for. I am not asking her to perform surgery, I am asking her to be present. His eyes moved to Nadia. If she's willing. Nadia looked at him for a moment. Then she looked at Dr. Stahl. Dr. Stahl was a man who had, over 11 years, developed a precise and functional hierarchy of things that mattered. At the top of that hierarchy was patient outcomes. Everything else was downstream of that, including the particular kind of paperwork that would follow a credential exception, and the conversation he would eventually need to have with the administrator who had retreated diplomatically to the hallway. He could manage both. He had managed worse. I'll adjust the surgical team manifest, he said. Nadia, you'll scrub in as a support role. What that means in practice? He left the sentence open. I understand what it means in practice, Nadia said quietly. The next 2 hours moved the way time moves in operating rooms, collapsed and expanded at once, every minute both eternal and instantaneous. Dr. Stoll led the surgical team. Nadia was there as she had agreed to be, in a supporting capacity that the paperwork would describe, in the most procedurally appropriate language available. But the people in that OR would remember something different from the paperwork. They would remember her hands. The particular steadiness of them. Not the steady of someone who hadn't seen enough to be afraid, but the steady of someone who had seen enough that fear had become a tool, rather than an obstacle. They would remember the moment during retraction, when a bleeder opened faster than expected, and she had already moved, already anticipated, already had her hands exactly where they needed to be. Before the instruction was given, Dr. Stahl had glanced at her over his mask and said nothing, but his eyes said something that didn't require words. They would remember that she talked to Paige through the anesthesia window before he went under. Not clinical assurance. Not the scripted comfort language that most medical staff employ in the seconds before sedation. Just a few words quietly, that nobody else in the room heard. Whatever she said, his blood pressure steadied, and he went under without the resistant spike that often marks a patient whose nervous system doesn't trust the room it's in. The surgery went well. The fragment came out cleanly, without the complications the imaging had suggested were possible. The shoulder wound, already assessed, required no additional intervention. By 2:40 in the morning, Douglas Paige was in recovery, and the OR was being cleaned. And the team was dispersing with the particular quiet of people who have done difficult work and come out the right side of it. Nadia stayed. She stood at the window of the recovery bay, watching the monitors, watching the slow, steady rhythm of his breathing, the way a person watches something they weren't sure they would see. The trauma team had cleared. Staff Sergeant Dowd was stationed outside the door. The night shift had absorbed everything back into its ordinary rhythms. The hallways, returning to their familiar low-grade hum of machines and soft-soled shoes, and the muffled sound of someone's radio down the corridor. When Paige's eyes opened, there was a moment, the confused, surfacing moment that follows anesthesia, before he oriented. And then his eyes found her, and the confusion cleared, and he was simply there, present and looking at her. She moved to the bedside. She checked his monitor without looking at it, her attention on him. "Still here," he said, his voice rough from the intubation. "Still here," she confirmed. He was quiet for a moment. The hospital had that specific stillness it gets in the hours before dawn, when the previous night's crises have settled, and the next days haven't started. Outside the window, Chicago was doing what Chicago does. Somewhere beyond the glass and the city lights, a life was carrying on that had nothing to do with any of this. "You know they'll ask questions," Paige said. "After tonight. What happened in that room, what came out? People in this hospital are going to want to understand." "I know," Nadia said. "Is that a problem?" She considered the question with the same measured honesty she'd been bringing to the night, since the moment she set down her clipboard and stopped pretending. "Not the way it used to be," she said. What she didn't say, and what didn't need to be said, because he was a man who had spent his career listening to what people didn't say, was that she had spent 19 months being afraid of exactly this, the recognition, the exposure, the unraveling of the ordinary life she had built, thread by careful thread around the person she had been. Before Sal Kimura didn't come home, she had been afraid that if the past found her, everything she'd built after it would dissolve. The hospital, the patients, the specific and unglamorous work of being present for people on the worst nights of their lives. But the past had found her, and she was still here, still a nurse, still herself, whichever version of herself that was. 19 months ago, she said, I walked into this hospital and told them I was a nurse who had taken an unconventional path to licensure, and wanted to work nights in the trauma bay. They said fine, that was true. All of it was true. The only thing that was missing was the reason the path was unconventional. And now that's not missing anymore. In this room, she said, yes. Paige was looking at her with an expression that had gone past gratitude into something quieter and harder to name. For what it's worth, he said. Sal Kimura's name is in a commendation file that nobody outside of federal oversight has ever been permitted to see. He was cited for the Meridian operation. Both of you were. A pause. I made sure of that, when they finally told me enough to understand what happened. Nadia was quiet for a moment. The monitor beeped. Somewhere down the hall, a door opened and closed. Thank you, she said simply. No performance in it. Just the thing itself, offered and received in the 3 a.m. stillness of a recovery room, in a hospital on the north side of a city that was, at this particular moment, carrying on without any knowledge of what had just happened inside it. She stayed until his vitals were stable enough that she could leave without it. Meaning anything other than the ordinary end of a task. She picked up her chart. She straightened her sleeve, the right one, covering the scarred wrist, without thinking about it. Or perhaps thinking about it differently than she had before, because the motion felt less like concealment and more like habit. Which is a different thing entirely. At the door she paused. Get some sleep, she said. Brennan, he said, and the word stopped her. She turned. The name you use now, he said, is it yours? She thought about it. Not the legal answer, but the real one. The name she had chosen deliberately, because it sounded like someone who had arrived on the other side of something difficult and decided to stay. Yes, she said, it is. She walked out into the corridor, and the ordinary night of the hospital received her back without ceremony. The same hallways, the same fluorescent lights, the same sounds. A nurse walking toward the supply room with a clipboard. A technician checking a monitor. The low, steady pulse of a building full of people managing the gap between life and its alternatives. The staff at Lakeside General, who had been in that trauma bay, would not forget what they saw. They would piece it together over the days that followed, filling in what they didn't know with what they could infer. And they would talk about it in the particular way that people talk about things that don't quite fit inside the categories they've been given. The quiet nurse who worked nights in the trauma bay, who always wore her sleeves long, who handled emergencies with a stillness that nobody had ever quite been able to explain. They would not see her differently, exactly, but they would see her more fully. And that, for someone who had spent the better part of 2 years reducing herself to a minimum, turned out to feel less like exposure and more like, at long last, being known.